Hi, and welcome to Detours Understanding Acquired Brain Injury. I'd like to introduce you to a new host. I've been talking about this for a little bit. I'd like to welcome Joyce, and we're going to be talking about aneurysms and strokes and whatever is of interest to her in relation to acquired brain injury in the vein of strokes and aneurysms and things like that, and whatever else you'd like to cover as far as being a survivor and things as far as that topic is concerned. Joyce, I'll let you take it away.
Thank you, Mark. I'm proud to be there, and I got a retinal stroke in April of 2009, and I'm unconscious for medically unconscious for 8 days, and when I woke up, I saw my son playing the guitar and my other son crying, and that was all. So it was at Capitol Health for in New Jersey for a month, and I went to um, a Backrack Institute for rehabilitation for 6 weeks, and I went to a nursing home that I won't mention because it was awful. So I was in and out in the Capitol Health, but I woke up just in time for Bacharach, and it was such a go. And I thought I was going to die. I thought most people were going to die when they had a stroke, but I didn't die in a year, so I'm happy about that. I wanted to commit suicide before 2 years, but I couldn't get the apparatus to commit suicide. Where is Jack Kevorkian when you need him? I went to a country club after 2 years, and this woman came up to me and said, "How are you doing?" I hate that question. How can I be doing? My life could turn 100 degrees. So I said, all right. So I said, she said, you're a writer. I said, yes. You write technical writing, right? Yes. You write instructions for how to use computer, right? Yes. So what do you write? What do you write something? And the next day, I discovered how to run a blog, Google's Blogger, and then I personally went to WordPress because it was, as Daniel suggested, Daniel is a guy who's a technical genius, and who is and I went to WordPress and never looked back. So yeah, I'm writing WordPress now, but the experience was sometimes good, mostly bad. I had a precursors when I first got sick. Originally, I had three precursors. First one was I got pain in my leg. So the doctor said, you have a blood clot. So he said, well, you have to stay in the hospital for blood clot. So I was admitted. And the nurse at 2 a.m., the nurse said, don't worry, honey, you won't have a stroke. Maybe you won't have a stroke. I don't know why she told me that story. Her sister was 2 years old and she had a stroke. Why would she tell me that? I didn't have stroke in my mind at all. The second precursor was medication. I was in Lovenox, and because they thought it would break up the clots. And I didn't. So a third one, I had a horrible headache night before. Well, I regret ever since not going to the hospital because if I went to the hospital, they would see I'm going to have a stroke. So, right, Mark, would that be the case?
Yeah, the thing is, there are a lot of ways strokes can express themselves. Although, and here's the thing, there 85% of strokes are what are called ischemic strokes, which is where the blood vessels are blocked. Now, those of you who know me know I worked in the emergency room for a long time, and I worked EMS also. But 15% are or a hemorrhagic stroke, which is where blood vessel ruptures. Sometimes they are due to a weakness in the blood vessel walls. Other times they can be induced by trauma. So if you're in a car accident or something like that, or you have what's called an arteriovenous malformation, which is like a tangle of blood vessels that are weak, and you are born with that. And most people don't get a magnetic resonance angiogram or anything fancy like that. So they have no idea. They have one of these ticking time bombs in their heads. And here's something to note:
Yeah, that's
one
right.
out of 50, one out of 50 will have an aneurysm. One out of 50 people. And so it is important if you have problems with hypertension, if you have problems with blood vessels elsewhere in your body, it is often reflective of the fact that you have potential weaknesses, things like delamination, and you can also have like the formed aneurysm, where you basically the inside layers of the blood vessel, mainly of arteries, become weak and peel back, and the outer tunica will swell up and will rupture and will bleed. You also can have sudden vasoconstriction or arterial constriction. And what that does is it clamps down on the blood vessel and cuts off the blood flow. So it acts more like an ischemic stroke. But there are a lot of things that can trigger that, including, a lot of tension or like excessive cortisol, things like that. So it's a real complicated topic. And you can have like occult strokes, which do not appear on. I was talking about this with a friend of mine. And you can have occult strokes, which manifest like with psychotic symptoms, other things like that. And they're not detectable on a standard MRI. And this is where I'm going to be talking later on about things like diffusion tensor flow and SWR and DWI and other imaging techniques specialized necessary to see. But like, for example, a magnetic resonance angiogram can pick them up. Your standard X-ray imaging techniques usually don't pick them up as readily, but you can have an arteriogram and other procedures for imaging. So again, it's kind of complicated, but when I talk more about neuroimaging, I will get into later into other imaging techniques that would show this type of internal vascular
What
delamination
would
and things.
CAT scan show it?
What?
Will a CAT scan show that I'm going to have a stroke?
There are CAT scans that do use a specialized contrast. There are CT arteriograms. I have that on my video. I do talk about CT angiograms. And yes, I will talk specifically about angiography and imaging of the brain for vascular disruption. I've been told by a couple people it gets a little too technical. I apologize. Um, I do get a little enthusiastic, and when I was studying neuropsych, we did get fairly into the weeds about imaging, and sometimes like get a little carried away. But basically, yes, accuracy. If you have a neuroradiologist who can help you with interpretation, that really makes a difference. Plus, computer-aided imaging, which is a fairly new technologies using AIs to help spot things that even a human can't. It's like, see that little tiny dot there in the corner? That. And it's like, oh, and you'll get it before. But
Who identifies a tiny dot? A radiologist?
with a neuroradiologist
Oh,
who is a subspecialist radiologist who studies just the brain, spinal cord, stuff like that. Um, You also can have different types of emboli. You can have like a piece of plastic that, when they're doing a catheterization, maybe shears off or something like that. And I don't wish to scare you. This is like so rare that it's like it ends up in medical texts. It's something that happens like one in a gazillion cases. So this is not common. And by the way, I remember in the emergency department, people are like, oh my God, there's bubbles in my IV. I'm going to have a stroke. No, no, you would have to give the person an entire IV line full of air to get a stroke from that. No, a couple little bubbles in your IV line are not going to give you a stroke. I'd have to, it's like hanging it. I'd have to shoot the entire line full of air. And if somebody does that, they're either beyond incompetent or they're trying to. But a few little bubbles are not going to do that. Now, if you've got a competent nurse or doc or someone, there, it's like, hey, could you please knock the bubbles out? Because it's like, come on, seriously. It's like, have a little self-respect to you docs or nurses or anyone who watches this. A little self-respect and get those bubbles out of there. All you got to do is just like tap the line, just like hold it tight and like flick it. You can knock those bubbles out. A little self-respect, people, please. All right, sorry, I digress. It's like professionalism out there. Come on. All right, sorry. Anyway, yeah,
Anyway,
yeah,
I when I went to back rec, first I say I was not the most compliant patient because I challenged everything.
right, yeah,
Uh,
good.
I'm sure she was like that, but uh, I challenged everything. The
As you
medicine I
should.
got without talking. I said, and the food I ate, and one day, about a weekend, I took a shower. So the nurse just wrote me. I got into the shower. I took a shower with a man. A man was in there. See, a nurse was in there. So I said, "Well, what are you doing there?" I was covering my breast. I said, "He's going to shower you." That was very odd. But anyway, I took a shower with a man as the name of my chapter in my book. So I took a shower and the guy was soaking wet. And so I took a shower. I felt better. But one day, 2 weeks in, I got upset for no reason at 2 a.m. So I called the nurse. I said, if I was going to talk, so she said, I'll help you. And she shot me like that. So I said, what did you drop me for? Uh, so she said, I'm pregnant. I can't rest. So it was a such and go situation from the start. But I got to do what I wanted, was allowed. I asked a question most of the times. Why am I doing this? Why am I doing this exercise? And then they said, just keep doing it. Just keep doing it. They never answered. They never answered. So that was one of my complaints. That it would take 5 seconds to tell me why, but it didn't answer. So I, I, I went to the activities room once and twice and 3 times, and I didn't want to go anymore. The what do you call the people who take you to the rooms?
Oh,
Sure,
the transporters.
chauffeur, chauffeur. Picked me up, and the guy picked me up, and I said, "Look this." A nurse told me. A nurse told me. I said, "What is your problem?" I don't want to go. So she respects my wishes, and the doctor agreed that I didn't need the I needed an activity because the activities were what was the time, in my opinion. They try to give you stuff that takes your mind off. But yeah, how can you take your mind off? I love my job. I'm a senior legal trainer at Coast and O'Connor in Philadelphia, and I love my job. So, well, how can you take your mind off of that? So, I, like I said, I wasn't the most compliant person, but I questioned most things. So one day, about 3 weeks in, I took a swallow test. A swallow test is to see if food passes from your, what is it called, your throat to your gut.
Well,
Uh,
from your oral, from your oropharynx
yeah,
down your
yeah,
esophagus to your stomach.
exactly, exactly. And I failed it.
Hmm.
So I had to go on, I had to keep the feeding tube in me. Once the feeding tube came out, I was so I was so appreciative of the tuna fish sandwich. I read about that in my book. I was so appreciative that I could eat again. So I have the man. Uh, um, uh, a man came in to the dining room, and he had nowhere to sit except across from me. So I invited him in. I could talk by then, and I said, and he sat down. I said, I don't know how to eat this. So I said, well, I'll help you. I was already a helper. I was always a helper from my childhood on. So I cut it up and placed that species for him, and he ate it. He ate it, and I was so happy for him. And then I realized I would not be happy unless I had empathy. So I discovered I had empathy then. And I continued with the, as I say, um, another thing that happened, a funny thing that happened, I was at weeks later, I was at a room full of people. Everybody came at once. The trainer and the training manager and the people who I knew and friends who I didn't know were friends of friends. All came at once. I had 10 people in the room. So I said, one of them said, well, you're not wearing a bib, you the stuff in your chest. So I was eating. I was eating. So I said, well, uh, I don't like bib. So don't you know that everybody sent me a bib? I had 15 bibs by the time 3 days later. So one of them was uh, Golden May. Golden May bib. Where did I wear that? So I put them out in the middle of the dining room and said, here, for free, go take them. So everybody took them, but left the Golden May uh, uh, bib. And they took a good taste, a good taste. So that was what happened to me. And there were times I lost a relationship because of it. Many
Sorry.
people do. And
Hmm.
one thing about the relationship, this guy uh, said, you have to watch this movie when I came home. And I said, well, what is it about? A woman who had a stroke and was married to this guy. And the end of it was he poisoned her. And the next day, uh, put a bed and moved to Pittsburgh because uh, Pittsburgh was a safe place because my son was there. So he
Right.
traveled 300 miles to get
That's
away
kind of
from
weird. I gotta say,
So that was my story. And um, I lived in Pittsburgh until for 5 years until I got to Portland. Portland's so wonderful. They're strange, don't doubt. It's it's bizarre, but I love it.
well, I can't say much for Pennsylvania. It's pretty weird around here too. I mean, I think
What is weird?
this whole country's weird. Um, Yeah.
Yes, that's for
The
sure.
United States is a weird country, but I mean, you can find weirdness all around this planet because human beings are weird.
But they're rooted in Portland.
I can't speak to that. No, I cannot speak to the weirdness of Portlandians, but uh, this is why I am sure aliens like fly right through our star system. It's like stay away from there. Do not communicate with the people down there. They're still developing. Maybe in a million years they'll be worth talking to, but not yet. That's what I suspect happens. That is why we have not truly been contacted by intelligence because we're not quite smart enough
That
yet.
is confusing.
They stay in warp speed when they go through our star system. That's what I'm convinced happens. All right. So any advice or anything like that you'd want to offer? Like people who just, it's like who've had their stroke recently or anything like that, or have had an aneurysm or whatever, just coming out of it. As you said, the first 2 years were very rough and your time in a nursing home and stuff, very difficult. And your feelings are very similar to like me and, stuff like that with traumatic brain injury. There's not much difference, like as far as its effects on you emotionally and psychologically and physically initially.
That's why I said stroke and other brain injuries.
Yeah,
I
no,
don't
no,
know about brain injuries because stroke
yeah,
in itself is a brain injury. As
yes.
a trauma.
That's why you're here in acquired brain injury on my channel. So
Thank
any
you.
advice? Do you have any advice?
Uh, I would say first, what advice I would give: if you see anything changing, anytime, if you're healthy, I don't know, low cholesterol, low blood pressure, no anything, I was healthy. If you see anything changing, go to the hospital right away. I didn't go to the hospital, and I had a stroke that night.
Mhm.
I would say go to the hospital. The second thing I would say is um, if you uh, are in a rehab facility, until you to continue to ask them why, why am I doing this? Because the
Yes.
person wants to know why, and the backward never told me why. So I resented that. I resented it after that was asking a stupid question, but not stupid. For example, they have my march. They have my march. You can see it. But they have my march. I said, what is the marching for? Just to keep doing it. Just keep doing it. And like that.
Mhm.
Um, uh, and I resented that. But that was a long time ago, but it feels like yesterday.
Mhm.
The third thing I want to offer is your brain injury, your traumatic brain injury. You remember certain things that will never go away. You remember certain things and you remember them always.
Mhm.
I remember the bad stuff.
Mhm.
I remember the good stuff. It isn't anything good, but I remember the care that I got. But it's nothing bad. And your brain protects you from, your brain protects you from the bad stuff. Right, Mark?
No. Well, let's be, like each person's brain injury is different and unique to each individual. I'm not going to quickly say no. However, it is important to know, like the reason you're unconscious is because the deep areas of your brain that stimulate the higher cortex it is disrupted. Communications is disrupted. It provides awakeness and wakefulness. That's not coma is. It is an electrical disruption. But like what you remember and stuff, it takes a while for the hippocampus and the other parts of your brain that are associated with memory to start working again. And so there's a lot of electrochemical disruption. But I do want to stress your second point. Medical professionals need to treat patients with respect, whether they can talk or not. They still, most understand. And even if their higher cortical functions are not working, they still can hold and retain at least the feelings associated with it. Even the lower order animals retain emotion and affect. And so it is important to treat people with respect no matter what. And people in comas, unless you're absolutely at the bottom of the Ranko Los Amigos scale at the one, they're aware. They just can't coordinate, move, and function. They may not be able to talk or remember at higher level of awareness. But there's a degree of memory. This is why we say to families, talk to your loved ones. There's some level of awareness. So respect is really important. Respect the patient.
Why do you think that most people don't recognize the struggles and brain injury?
Um, well,
I want to get your opinion.
you mean recognize a stroke is brain injury. It is non-traumatic brain injury. It is a non-traumatic brain injury. It is an
Stroke and
acquired,
injury.
it is an acquired brain injury, but it is not a traumatic brain injury. In other words, there's no force
Okay.
applied, but it is still an acquired brain injury. It is not something you're born with, and it is not something, it's not congenital, it's not genetic, and it is not progressive. It is a non-traumatic acquired brain injury. But most docs, unless they specialize, most nurse practitioners, unless they specialize, most nurses, unless they're specialists in brain injury, do not know what they're dealing with. And most families have no idea either. It is a highly technical, highly specialized area.
I want to say there is a test. Back up. I had discovered 10 years later that had um, found a protein, protein S and protein C deficiency.
Mhm.
That's why I got the stroke. That
Yeah.
causes blood clots. So that's why I got a stroke. But I
Mhm.
will tell you there's a test for protein S, protein C
Mhm.
deficiency now. So
Right.
go and take the test if your family has any relationship to
Yeah.
stroke at all.
Right. There are a lot of reasons why you can have a stroke. It's very complicated. It's why it's a whole field. It's a subfield within neuroscience, within neurology, and knowing these things is important for docs and like NPs and anyone who's involved with brain science, neuroscience in general. And again, as you said, you're absolutely right. Even if you do all the right things, you could still have something, a ticking time bomb inside your body. And so sudden changes, like your foot goes numb, you start seeing double, you start hearing strange sounds or something like that, get help. A sudden headache, um, mouth starts drooping, you suddenly start slurring your words immediately. That's a 911 call. That is, call the paramedics because they could do more than you can driving to the hospital going, oh crap, and then crashing into somebody else or having an accident. That's a paramedic call. Check out my thing on what the paramedics can do for traumatic brain injury. They could do it for strokes too. In fact, some EMS units carry clot busters. And that's a go upstairs to the neurointerventionist who could do things like, pull a clot or administer certain drugs. And they could do those procedures right
Wow.
then and there. Um, so, yeah. I understand you have a book. Yeah, could you talk about your book?
What other questions do you have for me?
Me, I don't have any, but you have a book, I understand you have written.
Tales of a stroke patient. The tales of a stroke patient.
Tales of a
And
Stroke Patient.
people's choice because I don't know if you get it the first time, but tales of a stroke patient is about my adventures before, during, and after the stroke. So
That
if you have a stroke or have a friend that has a stroke, respect a stroke, buy it. Thank you.
by Joyce Hoffman. Now, you know that we don't endorse anything specific or medical or anything like that, but you know what our hosts say, that's their opinion, their right to voice how they feel and they think. But Tales of a Stroke Patient by Joyce Hoffman, we can probably order it off Amazon or any of the other
Amazon is
books.
the best. Amazon is the best. You know how much I get paid by Amazon to write
Oh,
the book?
oh no, how much? I'm
No,
afraid to ask.
$8, and I charge $20. $2 is all I get. I didn't write it for that reason.
No, no.
I wrote it health professionals and family members and friends to read it. And most of my customers are family members or friends. And
Right.
that's why I wanted to read it. Thank you.
Now you also have a group, right?
Yes.
What's the name of your group?
Brain exchange. Brain
Brain
exchange is
Exchange.
just many things, but first foremost, brain exchange is, gets you hooked with a pen pal, uh, writing partner. I wanted to say, but hooks you with a writing partner, and that is fabulous because you have to be heard by someone who experienced the same you did.
Yeah, excuse me. I
Yes,
apologize.
that is that is wonderful to
Whoops.
to
All
write
right.
to somebody, write to
All right.
someone
All right.
who
So, no, anything, because I could see our time is ticking, and obviously you have to go somewhere. So what I'm going to say is, I just want to thank you. This was a fun, chance to meet you and to introduce everyone to Joyce, who will be talking about strokes, aneurysms, and like the things you could do to help adapt. And we'll be having conversations like this. And I just really want to thank her. I want to recommend you check out her book, Tales of a Stroke Patient. If it's on Amazon, or find something that might interest you. And I just want to thank you again for joining our family
thank you, Mark. Thank you,
of
Mark.
Sure thing,
Thank
absolutely. And have a good day. And everybody else, remember, please click like and subscribe. Don't forget to hit that bell icon. And if you have any questions or anything for Joyce regarding stroke, aneurysm, or anything she talked about, please in the comments below, they'll be sent to her so she can answer them. And take care, and we'll see you next time.
thank you,
Bye.
Mark. Bye.
Bye.